think the VA was trying to modernize how they deliver IT services across the enterprise, and they have lots of silos. It's a very big organization across, I think somebody was telling me they're probably the biggest healthcare network in the world currently. And so really managing IT requests and tickets and issues is very cumbersome across such a big organization. So they picked ServiceNow as their choice platform to align to an idle process. But the intake of all those requests comes through a service portal, if you will, or a front end. And really what we did for the VA is went through best practice to design the service portal to make it simple but effective to really drive adoption, right? We went live 45 days ago to over 500,000 people to access the service portal and make those IT requests. And not only to track tickets and make, have an issue with a system, but also providing feedback back to the user, right? What's the status of my request? Where is it at? Who is it? Where is it stuck in the process? And really the end result is once we have the intake, ServiceNow's workflow engine can really automate a lot of the fulfillment of those requests. The fact that ServiceNow is so easy to configure and to deliver very effective portals to end users, it makes it easier for the VA to deliver that service. And really, our purpose is have technology get out of the way of meeting the mission. It should be an enabler to reach your business objectives. And those objectives are really driven by what does the VA want to achieve. But at the end of the day, we're all people, right? And so the mission of ServiceNow personally is let's make work for people is really what we're trying to do. And Portal is one example of that. If a medical practitioner out in the field, let's say a surgeon, forgets their PIV card at home, they come into the office or to a VA hospital, they're not going to have access to the systems they need to do their job. So what ServiceNow allowed to empower the VA to automate that process through our workflow and orchestration engine, go straight to Active Directory, create the right rules and exceptions, so that they're able to do what they're supposed to do immediately without having that downtime of trying to manually try and reset their password or their PIV card. So that's just one example, right? But ServiceNow also across the federal government, we're at 150 plus agencies at different capacities. Some are more for IT back office support, but others are really innovative, right? So the smoke jumper program at the Forest Service is really using ServiceNow to onboard firefighters. When there is a disaster, they have to immediately get on board and go fight that fire. And then after that disaster is over or that critical moment, be able to offboard them easily and seamlessly. The experience for the end user could be very cumbersome, and the lag time to get there might have catastrophic effects, right? So the idea of ServiceNow with, you go to the portal, you onboard, you go through this automated process, background checks, all the other approvals that need to happen, reduce that time. Now that organization can meet their mission, right? So IT is no longer in the way, it's an enabler now to achieve those mission objectives. So the great thing, it's a platform. So once you ATO the platform into your environment, we're a partner where we have millions of customers or users where are making innovations on this platform. We can take and prioritize those innovations. We have a store where you can consume innovations. Once it's ATO'd, I can just add them to my platform. So my time to value is a lot faster as I can adopt new technologies. ServiceNow really talks about a lot of the end user experience, and lots of times we don't see how that will affect the end user. So on a personal note, I'm a cancer survivor. And so when I was diagnosed, I was given a statistic. You are going to survive 5 years, 75%. And I'm fighting against a statistic. And what they said today really resonated. They said, AI is allowing us not to just analyze you as a group, and this is a statistic, is really individually as a patient, how can that AI improve the service of those patients? And it's really relies on now having massive amounts of data. I think the age of information, when the internet came out, now it's the age of using that information to improve human lives. I know that in the future, my children will have better medical services because of the advancements we're having today in artificial intelligence, data analytics, and platforms like ServiceNow that can really help enable the enterprise to improve the service of their users and customers.